All right, welcome to video lecture number 1 for chapter 10, which is covering the cardiovascular system. So chapter 10 is going to obviously cover the cardiovascular system, so that means that we are looking at the heart and blood vessels and disorders within the heart and blood vessels. So in this video, we are going to start out by looking at some disorders of the heart, and more specifically, we are going to start with abnormal heart rhythms. And there is actually a medical term for abnormal heart rhythms, which is one of your terms for this chapter, and that is arrhythmia. Arrhythmia means abnormal or irregular heartbeats. And now your book doesn't do a very good job of explaining the various types of arrhythmias, so you can use the book to help you define the terms for this portion of the chapter, but I wouldn't use it for any help with the information. I did some outside research and put everything that I learned into this PowerPoint to hopefully make it a little more clear to you, because your book does not do a very good job. So let's start first with some anatomy of the heart. That is going to be pretty important to know for this video's information. If you've taken a nat and phys, or even I think just in basic biology, you should know this stuff, but we'll go over it anyway. So first off, there are 4 chambers within the heart. You have the atria, which is a plural form of the word. You might know it as atrium, which is singular. You have 2 of those. You have a left and a right atrium, and those are the upper chambers. And then you have the ventricles, which are the lower chambers, again of which you have a right ventricle and a left ventricle. There are valves that separate each atrium from its associated ventricle below. So there's a valve that is separating the right atrium from the right ventricle, and there's another valve that separates the left atrium from the left ventricle. And these valves opening and closing as blood is pumped through them is what causes part of the sound of the heartbeat. So you might have heard the description of your heartbeat sound as a lub-dub sound. So the opening and closing of the valves between the atrium and the ventricle is what gives us that lub sound. And the other part of the heartbeat, that dub part, is caused by the opening and closing of the aortic and pulmonary valves, which are located between the ventricles and the blood vessels that are connected to those ventricles. Now there can be abnormalities with these valve closures, which leads to a difference in the sound of your heartbeat, which is what doctors are checking for when they listen to your heart with their stethoscopes. An abnormal sound is called a murmur, which is one of your terms for this chapter. And if the abnormal sound is harsh sounding, then we call it a bruit, which is another one of your terms. Okay, so a murmur is an abnormal heart sound, and a bruit is when the abnormal heart sound sounds harsh, so an abnormal harsh heart sound. You also have a natural pacemaker within your heart that regulates your heart's electrical impulses and thus maintains a steady heart rate, and that is called your sinoatrial node, or your SA node. And this is going to be an important part of the heart that we need to know when we get into the different types of arrhythmias, so that you can understand what is actually happening within the heart for each one. So I'm going to break down the various types of arrhythmias into 2 categories. Your book breaks them down into 4, but they're so extremely similar that really it should just be broken down into 2. So we have the ventricular arrhythmias, and we have atrial fibrillation. And before we get into those 2 categories, there are 2 medical terms that we need to understand. The first is bradycardia. If you look at that word, the suffix "ia" means condition, the prefix "brady" means slow, and the root card means heart. So bradycardia is a slow heart rate, which is usually classified as a heart rate of less than 60 beats per minute. So bradycardia usually occurs when the electrical impulses that signal the heart to contract is not formed in your SA node. or they are not sent to the ventricles through the proper channels, which causes your heart to beat slower than it should. Bradycardia is common usually in the elderly, but it can affect even the very young, but it's not as common. Two common causes of bradycardia include a damaged SA node, usually due to some form of heart disease, just general aging, congenital defects, which is something that you're born with, obviously, or certain medications that you might be taking. And it can also be caused by some sort of issue with your central nervous system that does not signal your heart to pump regularly. That can also be a cause for bradycardia. So that word will come up later for different types of disorders, but we need to know what that means. And the opposite of bradycardia is tachycardia, which obviously the opposite meaning it's a fast heart rate, but if we break down that word, the prefix tachy means rapid. So tachycardia is very fast heart rate, usually classified as more than 100 beats per minute. And depending on where the fast heart rate begins, meaning which part of the heart is giving off that abnormal electrical impulse, will determine the name of the condition. So for instance, if it's beginning in the ventricles, then it's going to be called ventricular tachycardia, which we are going to talk about shortly. So usually it's not just tachycardia, it's more specific as to where that issue is arising that's causing your heart to beat faster than normal. So we are going to get into the first category of arrhythmias that are known as ventricular arrhythmias. So these are going to be irregular heartbeats that are coming from or caused by the ventricles of the heart. So like I mentioned a few seconds ago, the first one we are going to talk about is ventricular tachycardia. So this condition occurs when the SA node no longer controls the beating of the ventricles, and instead other areas along that lower electrical pathway take over the pacemaking role. And since the new signals don't have to move through your heart muscle along the regular route, the heart muscle does not beat normally, and instead it quickens. And so some people with ventricular tachycardia sometimes feel as though their heart is skipping beats. And you might also experience that shortness of breath, dizziness, or fainting, which you know as syncope. So because that electrical signal does not have to travel as far to get the heart to beat, that is going to speed up your heart rate. The second type of ventricular arrhythmias is ventricular fibrillation. Fibrillation is one of your terms, and it means uncontrolled quivering or twitching of the heart muscle. So ventricular fibrillation is probably the most serious arrhythmia that we are going to talk about. It is an uncontrolled, irregular heartbeat. So instead of having one misplaced beat from your ventricles, you're going to have several impulses that begin at the same time from different locations, all telling the heart to beat. So the result is a much faster, more chaotic heartbeat that sometimes can reach about 300 beats per minute, which is insane. And so this chaotic heartbeat means that very little blood is actually being pumped from the heart to the brain and the body, resulting usually in fainting. Now, what needs to be done when someone is experiencing ventricular fibrillation is immediate medical attention. Usually, if CPR can be started, that is ideal. CPR is one of your abbreviations, and it stands for cardiopulmonary resuscitation. Or if there's an AED in the area, which is also one of your abbreviations, stands for an automatic external defibrillator. That should be used to shock the heart back into its normal rhythm. If CPR and AED can be either provided or given very soon after the ventricular fibrillation begins, you can prevent a lot of heart damage. And defibrillation is also one of your words. It is the opposite of fibrillation. So it means to restore the uncontrolled twitching of heart muscles to a normal rhythm. So an AED, an automatic external defibrillator, is going to shock the heart to switch from fibrillation, where it is uncontrollably twitching, to restoring it back to regular, the normal heart rhythm. And about 220,000 deaths that we think are from heart attacks each year are actually, we think, caused by ventricular fibrillation, but people assume that they're heart attacks, and after the fact, it's hard to tell. So this is it's common, and it's very serious. So the third type of ventricular arrhythmia is premature ventricular contractions, or PVCs, which is also one of your abbreviations. This is a less serious type of ventricular arrhythmia that happens when the ventricles contract too soon or out of sequence with the normal heartbeat. So basically, these are extra contractions that beat sooner than the next expected regular heartbeat, and they often interrupt the normal order of pumping, which is the atria first and then the ventricles. So you can see in that image where that blue circle is, that is a premature ventricular contraction that happens prior to when the heartbeat should have happened. PVCs generally are not a cause for alarm, and often they don't need any treatment. Like in that image, obviously the heart rate goes back to normal. But if you have heart disease, PVCs can be a little more serious. They usually happen quickly and without warning, and often you just feel like an odd sensation in your chest, like a fluttering or a pounding heartbeat. And they can be caused by caffeine. Like if you're drinking a lot of caffeine, it can cause PVCs to take place. It can be caused by some over-the-counter cough and cold medicines. If you exercise too much, it can cause some PVCs, or if you have high anxiety. Also, high blood pressure, alcohol, anemia, or tobacco use can also cause PVCs. The second big category of arrhythmias is atrial fibrillation. Atrial fibrillation is a fast, irregular rhythm where single muscle fibers in your heart twitch or contract. This is the main cause of stroke in elderly people because it causes blood to pool in the atria of the heart, which can lead to blood clots. And obviously, if you remember from chapter 9, if part of that blood clot were to break off and travel to the brain and cause a blockage, that would cause an ischemic stroke caused by an embolism. So that for this reason, many patients with atrial fibrillation need what we call antiplatelet therapy, which prevents blood clots from forming and thus reducing the risk of a stroke. The first type of atrial fibrillation that we're going to talk about is Wolff-Parkinson-White syndrome, or WPW syndrome. This is a group of abnormalities that's caused by extra muscle pathways between the atria and ventricles of the heart. So the pathways use the electrical signals to arrive at the ventricles too soon, and when that happens, those signals are sent back to the atria. And the result is a really fast heart rate. People with this syndrome may feel dizzy, they might have chest palpitations or episodes of fainting due to that fast heart rate, and palpitations is one of your terms for this chapter, and it means a rapid or irregular heartbeat that lasts a few seconds or minutes. The second type of atrial fibrillation is paroxysmal atrial tachycardia. Some of these words are on your word list, and they are hard to pronounce. But first off, the abbreviation PAT, that stands for paroxysmal atrial tachycardia, is one of your abbreviations. Paroxysmal is one of your terms, and that means that the episode begins and ends abruptly, which we kind of talked about this word in chapter 9. So atrial refers to the atrium, which is where this arrhythmia originates, and tachycardia, the other of those three terms means that the heart is beating abnormally fast. So paroxysmal atrial tachycardia is a sudden episode where the heart beats usually between about 160 to 200 beats per minute. It's very sudden, starts and stops kind of abruptly. It's not life-threatening, but it can be very uncomfortable when you experience it. And so what happens to cause PAT is the electrical signals in the atria begin firing irregularly, which causes your heart rate to speed up. So usually women are at higher risks than men, and your emotional health can also play a role in whether this condition occurs or not. Also, being physically exhausted or having really high anxiety increases your chances of experiencing this condition. And also excessive amounts of caffeine or alcohol daily can increase your risk. So if you've learned nothing over the past video, it's usually that your anxiety level, being physically exhausted, or exercising too much, caffeine, alcohol can really sometimes mess with your heart rhythms. Now, the third type of atrial fibrillation is called postural orthostatic tachycardia syndrome, or POTS. Now, normally when a person stands up, like if you've been sitting for a long time and you stand up, your body needs to make needed changes to compensate for the gravitational stress of the change in body position. So what happens is, in order to keep that oxygen-rich blood flowing to your brain and upper body, due to that gravitational change on your body position, your heart rate increases and the blood vessels in the lower part of your body tighten, so that blood can get up to your brain even though gravity is pulling it down. In some people, this doesn't happen. So it affects their ability to stand or remain standing for long periods of time. So in patients with POTS, the blood vessels in their lower body do not tighten during standing. So because of gravity, more blood than normal is going to move toward their lower body. The heart is going to try to make up for this by beating faster, and if the faster heart rate does not help, blood can accumulate in the lower body, meaning that less oxygen-rich blood can reach the brain, sometimes leading to fatigue, lightheadedness, headaches, blurry vision, like a fogged kind of brain, or fainting. The last type of atrial fibrillation we are going to talk about is heart block. Heart block takes place when the SA node sends its electrical signal properly, but the signal is not sent through specific pathways as quickly as it should be. So you can kind of see it in this image, how it kind of stops before it continues, so it's not being sent as quickly as normal. This condition is most often caused by aging or by swelling and scarring of the heart that sometimes results from coronary artery disease. There are several different types of heart block, all named by their degree of severity. So the first one is called first degree heart block, which really isn't worrisome at all. It's not damaging. It's not like life-threatening or anything. It just kind of happens and then it stops. Second degree heart block is a little worse than first degree, and third degree heart block is very serious and can lead to heart failure and death. So first degree is the least worrisome, third degree is the worst. The last thing we are going to discuss in this video is various devices that can help patients with arrhythmias. The first is called a pacemaker. So these are battery-operated electronic circuits that generate electrical signals that are carried along thin wires to the actual heart muscle itself to help it beat correctly. These are mostly used to help patients with bradycardia or slow heart rate, just to help get their heart back to normal so that oxygen-rich blood is getting to where it needs to go. And the other is called an implantable cardioverter defibrillator, or an ICD. And this is one of your abbreviations. So usually people with life-threatening arrhythmias get an ICD implanted in their bodies, and its job is to sense when abnormal rhythms are taking place, and when they are taking place, it gives the heart a small electrical shock to return the heart rhythm to normal. And that is going to be the end of chapter 10, video 1.